One thing a lot of my fellow healthcare workers ask me is, how do you become a patient advocate and what is it that you do? Now, what I do is very different than what most patient advocates do on a daily basis. So I'm going to tell you how most people become a patient advocate, and then I'm going to tell you how I do it. So first things first, you don't need any special certification to work in patient advocacy. There are certificate programs and different educational programs that you can do, but they are not necessary in order to become a patient advocate. The only thing you really need is some specialized experience or knowledge in a certain area of healthcare. The range of what you can do in patient advocacy is extremely wide. So you can do everything from helping patients understand complex clinical diagnoses to attending doctor's appointments for patients and writing everything down so they don't forget it. The majority of patient advocates will either charge by the hour or by the service, and it's up to them to decide what they want that fee to be. So that's how the large majority of patient advocates help patients and make an income from it. But not me. I do something a little bit different than that. When I wanted to leave the hospital, I was working as a case manager. I am a nurse, but I was working as a case manager in the hospital, and I wanted to get into patient advocacy. I started by trying to find organizations who were already operating in the specialties that I was interested in. So I would look up like medical bill negotiation company, consumer rights lawyers, patient advocacy organizations, and then I would find them on LinkedIn or Instagram or their website, and I would send them a message. In the beginning, it was never about a business relationship with these organizations. It was solely about learning more about what they do and gaining the expertise that each of these organizations had in their own fields. But because I was volunteering and helping these companies in any way that I could, many of these companies began to really understand what my skill set was and really value having a nurse's opinion on their team. Eventually, they started hiring me to help them build out programs or work on certain projects. And then I still do free cases for you guys as well, as much as I can. So I fund that by doing social media ads. Which reminds me, if you see me doing an ad on your timeline, I am not trying to be annoying. I am just trying to fund my cases. Up until this point, I have never had to charge a patient for my services. And I'd like to keep it that way. So just so you know. So anyway, that is how I became a patient advocate, and it's been great. I have done everything from build out medical bill negotiation programs, build health platforms for underserved populations, legal and policy work. It's been amazing, and I've loved every second of it, to be honest.